In 2001, a real-world exercise tested the emergency response to a bioterror attack on the continental United States. The operation was called Dark Winter. Within just a few days, the simulation spiraled out of control. The operation predicted a rapid breakdown in essential institutions, civil disorder, and massive civilian casualties. Dark Winter has revealed how vulnerable we've become. Our lifestyle, our security, our safety depends on a delicate and unstable economy. We've created a system so complicated that we no longer understand how to control it. Oil, power, shipping, transport. We live in a complex world. And the more complex it gets, the more fragile it becomes. The system is built on a global supply chain that gets things where they're needed, just in time. We've created a house of cards. Remove just one, and everything falls apart. And what's fueling the system?
Money. Americans can spend $90 billion in a single day of shopping. Last year, 200 million people swarmed their local stores on November 23rd. We call that day Black Friday. Did you know that a flu virus can survive on the surface of a banknote for up to 17 days? One day there will be a pandemic. It could begin during the crush of Black Friday sales. A pathogen will jump from tainted banknotes to human skin, onto food, toys, children, and loved ones. By the time patient zero feels the first sore throat, millions of people will already be infected. From this point, the breakdown will happen fast.
Day 1, hospitals will reach capacity. Panic will strike. Day 2, quarantine zones will be established. Resources will be rationed. Transport will go into lockdown. Day 3, international trade will stop. The oil will dry up. The stock market will collapse. Day 4, the power will fail. The shelves will be empty. The taps will run dry. And once hunger and despair take hold, people will do anything for survival. By day 5, everyone will be a potential threat.
In 2007, a new presidential directive was signed quietly into law. This maps out the government's response to a crisis, a plan to cope with a real dark winter. It is known as Directive 51. There are rumors of shadow agencies, sleeper cells, covert agents, but nothing can be confirmed.
Our complex world is primed for breakdown.
And once the chaos strikes,
there won't be resources to save us all.
The only question left is, what will it take to save what remains?
Good morning, Chairwoman Eshoo and Ranking Member Burgess and distinguished members of the subcommittee. I am Dr. Rick Bright, a career public servant and a scientist who has spent 25 years of my career focused on addressing pandemic outbreaks. I have a bachelor's degree in biology and physical sciences and a PhD in immunology and molecular pathogenesis. I've led teams of scientists developing drugs, vaccines, and diagnostics in government, private industry, and for nonprofit organizations. I'm here today in my private capacity. The views are my own and not those of the Department of Health and Human Services. I joined BARDA in 2010, and for the last 3.5 years, until April 21st of this year, I had the privilege of serving as its director. BARDA partners with private industry and others in governments to address national health security threats. Today, the world is confronting a public health emergency unlike any we've seen in over a century. We are facing a highly transmissible and deadly virus which not only claims lives but also disrupts the very foundations of our society. The American healthcare system is being taxed to the limit. Our economy is spiraling downward, and our population is being paralyzed by fear, stemming from a lack of a coordinated response and a dearth of accurate, clear communication about the path forward. Americans yearn to get back to work, to open their businesses, and to provide for their families. I get that. However, what we do must be done carefully and with guidance from the best scientific minds. Our window of opportunity is closing. If we fail to improve our response now, based on science, I fear the pandemic will get worse and be prolonged. There will be likely a resurgence of COVID-19 this fall. It'll be greatly compounded by the challenges of seasonal influenza. Without better planning, 2020 could be the darkest winter in modern history.
Meanwhile, Minnesota's governor says he's going to do what he can to make sure what is happening in Wisconsin does not happen here.
Governor Tim Walz was part of a roundtable talk today on COVID-19. Susan Elizabeth Littlefield shows us how the state's fight is going against the virus.
They gathered around like old friends who are all fighting the same enemy, COVID-19.
I wake up after 14 days with completely no strength in the finger, no control in your hands to even bring the food to your mouth.
The professional musician was hit by the virus so badly he was intubated and in a coma.
It is no doubt that COVID exists. We have to deal with this big, huge enemy. And we are still dealing with that. And I think the only way we can continue to win the battle is working together.
And that's what the governor wanted to talk about, working together. 6 months into the pandemic, he gathered the health commissioner, a psychologist who lost her beloved mother to the virus, and an ER doctor whose entire family got the virus.
Yes, it was extremely challenging to take care of 4 kids while we were all sick with COVID-19, but we managed to make it through. It was terribly difficult. And I think so much about how hard it was for us and how much easier we have it than all the patients that I take care of.
I'm happy to say we're not particularly seeing the disparities widen, but nor are we seeing them close.
The governor said they will continue to collaborate and, for now, continue mandates on masks and bars because the battle is ongoing.
I said in March it was going to be a long, dark winter. We're still in that long, dark winter.
Susan Elizabeth Littlefield, WCCO 4 News.
Vice President Biden, your reaction, and just 40% of Americans say they would definitely agree to take a coronavirus vaccine if it was approved by the government. What steps would you take to give Americans confidence in a vaccine if it were approved?
Make sure it's totally transparent. Have the scientists of the world see it, know it, look at it, go through all the processes. And by the way, this is the same fellow who told you this is going to end by Easter last time. This is the same fellow who told you that, don't worry, we're going to end this by the summer. We're about to go into a dark winter, and he has no clear plan, and there's no prospect that there's going to be a vaccine available for the majority of the American people before the middle of next year.